that was our fourth shot with Bedroom Floor, Liam Payne, All My Life, Lil Durk, Roses, Finn Askew, and Eyes Closed. Right now, we're back again with Met in Focus, and today is a topic that we're going to be talking about amongst working people, and that is about the mental health under the topic Reach Out, Connect, and Seek Help, and the way to observe your health. Today, we are with Dr. Anothai Soonsawat, the Geriatric Psychiatrist at the Bangkok Mental Health Rehabilitation and Recovery Center, BMRC, in Bangkok Hospital. And not only that the doctor will be telling us, educating us, we have a prize to be given out to our metsters, and that is the e-vouchers for the quadrivalent influenza vaccine to prize. So if you guys are watching right now through our Facebook Live, share, leave your comments, and those comments under the Facebook Live, which either ones we use to, we pick it out to talk during the Facebook Live, will win a prize. Right now we are with Dr. Anothai. สวัสดีค่ะ
สวัสดีครับ Hello Good morning ครับ DJ Carla
Good morning So lovely to see you today, and it's a very interesting topic under the topic Reach Out, Connect, and Seek Help. I know that a lot of people are facing through problems, like a lot of problems, I would say. There's so much problems going on today, but we would like to talk to you about the top 3 mental issues in the working ages. Probably a lot of listeners are at the working ages right now. Number 1 is feeling tired or feeling drained all the time.
That definitely that is something that happens to so many of us, right? And for example, wake up Monday morning, you wake up in the morning and you feel like if there's any chance I can just call in sick today, or I just don't want to go to work at all. That kind of feeling is something that happened to us from time to time, right? And it's totally normal. It is something that happens to us, but if it starts to affect the function at work, once it starts to affect how we perform at work or how we concentrate in the meeting, that is a bad sign. It's a sign that maybe the way we live our lives is not as good as it's supposed to. Maybe you're having some burnout, or maybe it's a sign of depression as well. So that is something to try to observe yourself. If you have, exhaustion or overly tiredness all the time, that's the first sign.
Right. So I feel like this often happens on a Monday basis, where we just came from a long holiday and we wake up in the morning and we feel, oh, I don't want to go to work. Should I call in sick? So I think a lot of people are experiencing this, like literally today.
It happened to me this morning a bit as well. Coming to work and it's like, why do I have to come and talk to the metsters today? So that's why I'm here.
Yay! Right? And thank you for your time here today. And number 2, I think a lot of people are experiencing this, is the sleep problem.
Yes, absolutely. Sleep, going to bed is something that needs to happen every night, right? And from time to time, if we have insomnia or not able to have a proper sleep, it's totally understandable if it happens from time to time. But once it starts to become a routine of not sleeping, once it starts to become on a regular basis, that's a problem, because when we fall asleep, especially during the deep sleep phase, or especially during the REM or the dreaming sleep phase, that's when our brain tries to get rid of the messy feeling, the messy thoughts, or the garbage that we collected throughout the day, and to restore the function of the brain, and so that you can have a fresher morning, or you feel good in the morning. Without this deep sleep or the dreaming or the REM sleep, it's without these two, it's hard for you to have a better morning. So sleep is very important. Some people, when they're stressed out, when they have so much stress during the day, they can't sleep. And that affects how you function in the morning at work as well. So it's one of the common signs that tells you that something's not right.
I see. And another main problem that people are having right now is having a panic attack as well.
Yes, by definition, panic attack is the full-blown anxiety episode, the full-blown fear that, oh, I'm so going to die, or I know my heart rate is so high, I'm having heart attack, I'm so going to die. This is something that happens briefly. Normally it lasts about 20 minutes to half an hour and then stop. Right? It's not like forever.
Right.
However, it's so scary that sometimes some people avoid getting out of the house or avoid being in public because they're so fearful that once they're out there, there's no help and there's no one to help them. And sometimes people kind of, reserve or just stay inside the house all the time. That's a problem. Okay. And normally when I talk about panic attack, I always say that it's like the tip of the iceberg. There's always something underneath, conflicts or relationships problem, chronic stress, something underneath most of the time that affects you and causes a panic attack from time to time. Something to think as well.
Right. So, how are we supposed to know if we have panic attack or like mental issues are being developed? How do we look at ourselves and see, oh, this is a sign that I'm having mental issues?
That is a very good question. People with panic attack, when they have it, sometimes they feel that they're having heart attack or they're having, I can't breathe, I'm suffocated, things like that. And most people, when they have panic attack, most of them come to the ER, the emergency room, to be evaluated. Once having the EKG or the cardiac checked or the lung function test or having some tests by the medical doctor, once everything is clear, the doctor will tell you that okay, maybe this is something mental, maybe this is something relates to the anxiety, maybe this is panic attack. It is very important if you have panic attack to come to the hospital, maybe once, just to make sure that it's not medical, it's not the real heart attack. It's very important. Once, it's cleared out, the medical condition is cleared out, then if it is panic attack, it's worth talking to the professionals a little bit, maybe the therapist or the psychiatrist to solve the problem because there could be something underneath that needs to be fixed.
Right. So apart from you noticing that yourself, as a friend or as a family member who are with someone who's having a panic attack, are we able to tell that something's going on with them or what are something that we can notice?
Absolutely. When people have panic attack, it's going to be so obvious. You're sweating all over, you can't sit still, you're restless, you feel like, oh, I'm so going to die, help me, because it's like an intense, fearful episode. It's very obvious. So,
so literally it's like panicking.
Yes. If your friends or family have panic attack, it's going to be obvious and you'll see it for sure. What you can do as family or friends is maybe, okay, come to the hospital or, okay, it's okay, just sit for a little bit, it will go away. But if the episode is so intense, maybe, come to the hospital to have the heart checked a little bit. That's also important.
So when we do notice that we have panic attack or any mental issues, when we walk into the hospital, where do we go? Who do we go to?
Most of the time, since it is called attack, so it's something emergent. So most of the time, the hospital staff will guide you to the emergency room so that you can get help and, be seen by the emergency doctor right away. In the ER, the first thing that they normally do is check the vital signs to see that, okay, if the blood pressure and heart rate is okay, check the EKG, check the heart rhythm a little bit to see if it's doing okay or not. Once they clear everything out, then they will tell that, okay, this is the panic attack.
All right. So just go in, consult with the doctor and see how bad or how deep or how big your issues are.
Yes.
All right. Doctor, we will continue this in our Facebook Live, but thank you so much for your time. This is early morning and thank you so much for educating our metsters here today, but we will continue live with our questions from our listeners on our Facebook Live.
Thank you so much.
All right ขอบคุณนะคะ
ครับ
All right, Metsters who are listening right now and you think that you're facing with mental health issues or you know anyone who are facing mental issues, you can now contact Dr. Anothai Soonsawat at the Mental Health Rehabilitation and Recovery Center at Bangkok Hospital. So stay tuned for more information about mental health in this working age, but we will continue this on our Facebook Live. Hello, สวัสดี to a healthier you. Bangkok Hospital is here. Stay fit, boost brain power, and embrace your mental health. If you are health conscious and keen on achieving excellent health, don't miss up. Sign up on the event on the 9th of September during 2 to 4 p.m. at Move and Pick BDMS Wellness Resort. Key highlight includes health talk by our expert specialist, free on-site health consultation in sports medicine, internal medicine, sleep and mental health, ensuring a wonderful evening ending with a cocktail treat. For registration, check it out on our Facebook and Instagram, and for more information contact 02-755-1696. I repeat 02-755-1696. Stay fit, boost brain power, and embrace your mental health.
Met in Focus
คุณหมอได้ยินไหมคะ
ได้ยินครับได้ยินครับ
Okay, so we will continue this on our Facebook Live right now with Metsters listening. So if there's any questions, well, I'll read them out to you. All right, talking about mental health, I think it's becoming more common to see nowadays. Not just even panic attack, it's just depressions and people are seeking help. As someone who does not have depression, but do have a friend who has depression, I would like to know what are the do's and the don'ts of what to say and what not to say to people who are facing depression.
Yeah, and that is a very good question. And I wish I have a list of things that you can say and you're not supposed to say. Realistically, we don't really have things like that, because things that you say to one person, they're affected in one way. But if you say this to the other people, they're affected differently. So I think what's important that I learned along the way, treating depression or talking to people with depression is just to be there for them. Just sit next to them and try to understand what they're going through. One thing that is very important, we call it empathic listening or listening without judgment. Try to understand what they're going through, the thinking process, why they feel upset, why they feel frustrated, and without the pressure on yourself to give good advice or to say the right words. Just listen to them and try to understand them. And sometimes, even if you have to admit to them that, I don't know how to deal with your problem.
Right.
It is so difficult, but I'm here to help you out. If I can come up with any ideas, I'll let you know. In the meantime, have you eaten anything? Do you want to come out a little bit to exercise a little bit? These kind of kind gestures like this can be very helpful for people with depression.
Because I've read that if you actually say, it's okay, just try to be happy, go do things that makes you happy. I read that is not it's kind of like a don'ts of what not to say to them. Is it true?
It is true. It is true. And it's not the empathic listening style. Normally when you try to understand someone, you try to go with them, to flow with their story, right? But to tell them that it's fine. Don't think about it. Let's go out. Stop talking. It's almost like you're shutting the door right in front of them, right? So
okay.
if there's something that if they don't feel good, just flow with them, just go with them. And once they're okay, once they stop, then tell them that, okay, it's a big thing. I can only imagine what you're going through, but if there's anything that you want me to help, things like that, rather than just stop talking, let's go out for a run. That's not helpful.
It doesn't work that way.
No.
We have a question from our listeners. คุณอิทธิการจิตสมบูรณ์คุณแม่อายุ70ค่ะมีความดันสูงด้วยนอนไม่ค่อยหลับมีวิธีแก้ไหมครับ
Sleep problem. Am I supposed to answer this in Thai or in English?
ให้ตอบเป็นภาษาอะไรดีคะภาษาไทยหรือภาษาอังกฤษ
Both.
ภาษาไทยก็ได้ใช่ไหมคะ
ภาษาไทยก่อนเนาะ
โอเคไทยก็ได้ค่ะ
อาจจะปวดหัวนิดหน่อยก็จริงๆแล้วเนี่ยครับปัญหาเดี๋ยว I'll switch later okay so ปัญหาผู้สูงอายุเนี่ยครับเวลาเขาอายุมากขึ้นแล้วเขามีปัญหาเรื่องนอนไม่หลับจริงๆแล้วเป็นเรื่องปกติเลยนะฮะปกติแล้วเนี่ยถ้าทำความเข้าใจนิดนึงเนี่ยคนเราเวลาอายุมากขึ้นอ่ะความต้องการการนอนจำนวนชั่วโมงการนอนเราจะน้อยลงสมัยเด็กๆตอนเราเป็นเบบีเนาะเราก็จะนอนแบบนอนเยอะตอนวัยรุ่นก็นอนกัน10ชั่วโมง12ชั่วโมงทีนี้พอเราอายุมากขึ้นเรื่อยๆอะครับจำนวนชั่วโมงมันจะหดลงอายุประมาณสัก70ปีเนี่ยจำนวนneedที่จะต้องนอนเนี่ยมันอาจจะอยู่ประมาณสัก 5-6 ชั่วโมงเท่านั้นเองเพราะฉะนั้นเนี่ยการจำนวนชั่วโมงการนอนมันจะลดลงเป็นธรรมชาติที่สุดนะครับอีกเรื่องหนึ่งก็คือว่าความลึกของการนอนพอเราอายุมากขึ้นมันจะน้อยลงเช่นสังเกตว่าในผู้สูงอายุถ้าเกิดเราไปพูดกับคุณพ่อคุณแม่คุณปู่คุณย่าเนาะบางท่านอาจจะบอกว่าก๊อกแก๊กหมาเห่าตื่นแล้วอย่างเงี้ยบางทีแบบใครเปิดประตูตื่นแล้วซึ่งจริงๆอันนี้มันเป็นเรื่อง normal เป็นเรื่องปกติสุดๆเลยนะครับซึ่งบางครั้งเนี่ยครับการมันมีแรงกดดันบางอย่างว่าฉันจะต้องมีสุขอนามัยในการนอนที่ดีฉันจะต้องนอน8ชั่วโมงตอนอายุ70-80อ่ะซึ่งมันเป็นเรื่องที่เป็นไปไม่ได้ตามชีววิทยาตามไบโอโลจีนะครับเพราะฉะนั้นอาจจะต้องคุยกับคุณแม่นิดนึงว่าคุณแม่จะเย็นๆพอนอนได้แล้วล่ะเอาแบบพอให้แบบตื่นมาแล้วรู้สึกพอที่จะสดใสทำกับข้าวใส่บาตรได้อะไรเงี้ยก็อาจจะพอใช้ได้อีกประเด็นหนึ่งก็คือว่าผู้สูงอายุบางทีเนี่ยจะแนปตอนกลางวันนะครับจะมีนอนกลางวันซึ่งบางครั้งเนี่ยนอนกลางวันถ้าสัก10นาที20นาทีไม่เป็นไรแต่บางคนนอนกลางวัน3ชั่วโมงเนี่ยแล้วก็บ่นว่ากลางคืนนอนไม่หลับนะ
โอเคเหมือนเด็กเลยนะคุณหมอเนาะ
ใช่ครับเพราะฉะนั้นผมว่าจริงๆอาจจะต้องค่อยๆคุยกับคุณแม่ใหม่ว่าคุณแม่โอเคไหมคุณแม่จะเย็นๆนะมันนอนไม่ได้เป็นเรื่องที่เกิดขึ้นได้เหมือนกันแล้วถ้าเกิดคุณแม่รู้สึกไม่โอเคจริงๆอ่ะคุณแม่สามารถค่อยๆมาคุยกับคุณหมออาจจะเป็นคุณหมอเมดinternal medicine ก็ได้นะครับหรือคุณหมอที่เป็น geriatrician ก็อาจจะพอช่วยได้นะครับทีมว่าให้ตอบเป็นภาษาอังกฤษนะเอาไหม
เอาภาษาอังกฤษด้วยไหม
ชื่อ
เอาด้วยไหมคะเอาภาษาอังกฤษด้วยไหมหรือว่าเรามีคำถามมาต่ออีกนะเนี่ยจริงๆแล้วเอาไหมโอเคถามเอานิดนึงนะเอาแบบช็อต summarize
Okay sure so biologically things change the sleep quality and the quantity changes with age people when they get above 60 years old sometimes the amount or the numbers of hours that they sleep reduce to maybe 5 or 6 hours so it's very important not to pressure yourself too much to sleep 8 hours at the age of 70 sometimes it's not going to happen and one important issue is that the depth or the quality of sleep changes with age as well. The deep sleep phase and the REM sleep phase decreases as we age. So it's very common for older adults to have lighter sleep comparing with younger adults. It happens. It's very common. If this is really a problem, you feel like you can go on in the morning, you're so tired throughout the day, maybe talking to the specialist, internal medicine, medical doctors, or sometimes geriatrician, psychiatrists can be helpful also.
Right. Another question coming from Kun Anita Pusanat. Very interesting. She says, คุณแม่หลังคลอดที่ไม่ได้อยู่ไฟจะเป็นโรคแพนิคได้ไหมคะ
How would I translate you Fai in English? I don't really know. Okay, I'll try my best. English first, okay? Normally, people after giving birth, sometimes they have depression. It's called postpartum depression.
Do you also call them baby blues?
It's a bit different. Normally, baby blues is just you feel a bit sad. You don't feel like you're having much energy. But to have the depression, that's a more severe form of baby blues. We call it postpartum depression. It's very concerning because sometimes when they have postpartum depression, they don't have any energy at all, even to raise the baby or to take care of the small baby. Right. And some mothers sometimes have thought of hurting self and when they have postpartum depression. So it is something that the family needs to observe, or the doctors or the pediatricians needs to ask the mothers also that, okay, if you're depressed or do you feel okay, things like that. It happens sometimes, but not that common to have depression or anxiety after giving birth. So it is something to speak up, it's something to talk to the doctors, because maybe there's some treatment or maybe there's some medications that can, improve this from happening, and maybe it will improve the quality you take care of the baby also.
But does it have to do with taking care of a Thai traditional old style that you fire, that's what they call it, and can it also lead to, after giving birth, to panic attack? Is there such thing instead of postpartum depression? Is it?
Not that I know of, because UFI is something that's a Thai tradition, and I don't think we have international research about UFI and
right.
anxiety attack. But if speculating about this, I don't think it correlates with and you normally to have anxiety or not. It depends on so many factors. There are people around the world who's not doing the UFI after delivery.
It's a belief. It's an old belief.
Right. So I think it's probably something else. Maybe the stress, taking care of the child, or maybe there's some genetic of depression and anxiety disorder in you, or maybe there's some depression that happens even before giving birth. That happens
right.
sometimes.
So,
and it's triggered.
If you're starting to feel like, you're really disconnected from your child after you give birth, you feel like you're doing everything wrong, but you don't know that that's postpartum depression. I feel like it's still new that people just started talking about it or seeing it on the news of how some mothers, tragic, committed suicide because of that. And I feel like this is still new. How can you tell that you are undergoing a postpartum depression? And how can you be there for someone who's going through that?
Raising a child is not a piece of cake. It's something that's difficult, and every parent, they need to go through these, process all together. But some people, tend to isolate themselves from the child. Some mothers can't go on anymore. I'm not a good mother. I'm not good enough at all. And they, instead of trying harder, they isolate themselves, or they ignore the child. That can be the sign of depression as well. And if the father or if the family members start to notice this, then, you have to come and talk, and nowadays we know that the depression happening after delivery is very hormonal. It relates to the chemical change in the body a lot.
Right.
So maybe, taking some medication or antidepressant, maybe that can rescue the situation and bring you back to become the mother that you want to be.
Mm-hmm. We have a question from Kun Pat Pisha Term Prida. I've got a dysthymia. For a while. I take pills every day, but sometimes I couldn't control myself anyways. I think the reason is same environment at work. So should I quit or no?
Quit the therapy or quit work? Okay, I'll answer both ways. Should you quit? I'm telling this to everyone dealing with depression, dysthymia. Okay, by definition, dysthymia is a chronic depression. Okay, and when you have depressed mood for a long period of time, and by definition, the depression is not that bad. The depression is not enough for you to make you feel suicidal, but it lingers in you to the point that you feel like you have low energy all the time, low battery all the time. You can think clearly all the time for a long period of time. That's the definition of dysthymia. It is something that can be pretty hard to treat because it's chronic. It's something that happens for a long period of time. The question of should I quit the job or not, I would say no, don't quit the job. I tell this to everyone that if you're depressed or you're having, crisis or mental health crisis or some sort of situations like that, don't make a drastic decision yet until you talk to someone or maybe talk to your psychiatrist, talk to your doctors. Okay, don't make decisions yet because sometimes it is something that we can manage. It is something that we can, try to make you feel better so that you can come back to work. It's very treatable. Depression is very treatable. If you feel that the depression is not properly treated yet, it's something to bring up with your doctors, your psychiatrist, or your therapist, because maybe medication is not enough. Maybe talking to a psychologist or talking to someone can be something that added on to the treatment effectively.
Right. And lastly, doctor, is there anything you'd like to say to the listeners right now listening who are maybe undergoing problems with or without knowing?
Something that is very important and I really, really, really want to talk is coming to see a psychiatrist or coming to see a therapist is something that's doable. We're not evil. We are just doctors that's trying to do our work and trying to do our job and trying to help out.
And it's not embarrassing.
Yeah. And if you feel that, it's something is bothering your mind, you feel frustrated, something is not right in your mind or in your head, it's okay to come and talk to us. Doesn't need to be me. It can be any psychiatrist or any therapist, any psychologist, anyone. Just talk it out. If you feel that talking to the providers, it's a too big step, then talk to your parents, talk to your wife, husband, friends as a first step. Don't just shut yourself in and hold it inside because that's not helping. Just talk it out.
All right. Wow. That's very, very nice advice. So metsters, don't forget, talk to specialists. For now, thank you so much, Dr. Anothai. It's been a wonderful live session with you.
Thank you so much. Thank you so much for having me.
All right. Maybe see you next time on our Med in Focus. All right. ขอบคุณนะคะ
ครับขอบคุณครับ
สวัสดีค่ะ All right, Medsters, for those of you who are feeling like you're having a problems and you needed to talk to somebody, don't forget you can always contact Dr. Anothai Soonsawat, the geriatric psychiatrist at the Bangkok Mental Health Rehabilitation and Recovery Center, BMRC in Bangkok Hospital. But for now, I'm going to have to sign off. Thank you so much for tuning in. It is such an interesting topic today. For those of you who missed out, don't forget you can rewatch them at our Facebook Live. But for now, I'm going to have to sign out and I'll see you next time. Bye-bye.